What if the routine you follow for a colonoscopy quietly lowers your gut's defenses, making you feel worse for weeks and increasing your risk of infection right when you need protection most?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining how bowel preparation for colonoscopy can strip protective mucus, reduce beneficial bacteria, shift your gut toward inflammatory microbes, and what you can do to limit harm if you choose to undergo the procedure.
I'm Alara Sky. We'll keep this focused on what current research shows about microbiome disruption from polyethylene glycol-based bowel prep, why people with inflammatory gut conditions are hit harder, and the specific choices that support faster recovery.
Colonoscopy is used for cancer screening, symptom evaluation, and monitoring conditions like inflammatory bowel disease. The preparation relies on strong laxatives, most commonly polyethylene glycol. It draws water into the intestines to flush stool, but that rapid purge also changes your gut environment in ways that extend beyond a clean viewing field.
A recent mouse study helps explain the immediate aftermath. Polyethylene glycol triggered diarrhea that thinned the protective mucus layer and sharply reduced beneficial bacteria. Levels of short-chain fatty acids such as butyrate fell, removing signals that help your immune system stay regulated and that keep oxygen levels low in the colon, conditions your helpful microbes depend on.
When researchers exposed mice to salmonella after bowel prep, infection risk rose. Bacteria expanded in the gut and moved beyond it to the spleen, liver, and lymph nodes. The animals recovered from the purge itself, yet there was a temporary period of reduced defense. That raised the question of what happens when inflammation already exists before prep.
To probe that, investigators induced colitis in mice. Under those inflamed conditions, the same bowel prep led to more tissue damage, deeper inflammation, and greater vulnerability of the intestinal lining. Bacterial translocation was more likely, meaning microbes crossed into places they should not be, amplifying systemic immune activation.
They also colonized germ-free mice with bacteria from healthy donors or from people with ulcerative colitis. Under bowel prep conditions, microbes from ulcerative colitis donors survived better, expanded faster, and were more likely to spread outside the gut during inflammation. This shows that an altered baseline microbiome plus inflammation can magnify harm from prep.
Human data reflect similar patterns. In the United States, colonoscopies are common, and 40% to 45% of patients report bloating, abdominal pain, or indigestion within 7 to 30 days afterward. A clinical endoscopy review attributes much of this not to the scope itself, but to prep-driven dysbiosis. Total bacterial counts drop, diversity declines, beneficial groups such as lactobacillus and key Clostridia fall, and opportunistic proteobacteria gain ground.
Mechanistically, the purge removes loosely attached microbes and thins mucus. During the procedure, air introduced into the colon increases oxygen exposure, favoring organisms that tolerate oxygen, while suppressing anaerobes that produce butyrate. Since colon cells use butyrate efficiently, losing those producers alters local conditions in ways that prolong imbalance and irritation.
Recovery timelines vary. Many healthy people see microbiota measures rebound in 2 to 6 weeks. If you already have gut inflammation or low diversity, recovery is slower and less predictable, and some taxa may not return to baseline. That sustained shift explains lingering discomfort after a single procedure for some individuals.
Technique matters. Split-dose prep, half the evening before and half the morning of, disrupts the microbiota less than a single large dose and is linked with faster recovery. Using carbon dioxide rather than room air to inflate the colon during the procedure reduces oxygen stress, is associated with fewer post-procedure symptoms, and supports a quicker microbial rebound.
You should also weigh procedural risks. Perforation occurs at roughly 6 per 10,000 procedures, and bleeding at about 24 per 10,000 after polyp removal. Anesthesia use varies by region and is associated with higher complication rates, including aspiration pneumonia and intraperitoneal hemorrhage. Reported mortality estimates range from about 1 in 16,318 procedures to 3 per 100,000, with serious adverse events in the tens per 10,000. Another practical risk is equipment contamination. Flexible endoscopes cannot be heat sterilized. Facilities relying on glutaraldehyde solutions may preserve residual material, whereas peracetic acid dissolves proteins more effectively. You can call ahead and ask which method is used.
If you move forward with colonoscopy, a few steps meaningfully reduce harm. Choose split-dose PrEP when possible. Ask whether carbon dioxide insufflation is available in place of room air. In the days before PrEP, increase prebiotic-rich foods to feed beneficial microbes. Leeks, garlic, onions, asparagus, and green bananas are examples. Do not rely on probiotics before the purge. They will be flushed.
Right after the procedure, begin with easy-to-digest, supportive nutrition, bone broth, soft-cooked vegetables, and fermented options such as kefir, sauerkraut, or unsweetened yogurt if tolerated. After a couple of days, add higher fiber foods to stimulate short-chain fatty acid production, and then reintroduce high-quality probiotics.
While your lining is recovering, avoid ultra-processed foods and seed oils high in linoleic acid, including soybean, corn, sunflower, and canola oils. Choose anti-inflammatory fats such as grass-fed butter, ghee, and coconut oil, and include omega-3 rich foods like wild salmon. These fats align with a gut environment that needs less oxidative and inflammatory pressure during recovery.
Some people may decide to skip colonoscopy based on personal risk assessments and lifestyle factors. Others at higher risk may benefit significantly. What matters is an informed decision that accounts for both benefits and the real, documented microbiome costs of PrEP. If you proceed, coordinating with your care team on technique and nutrition gives you the best chance at a smoother recovery.
Here's your challenge. If you're considering colonoscopy, call the facility this week to confirm split-dose PrEP and carbon dioxide insufflation, and ask about peracetic acid sterilization. Plan 3 days of prebiotic-rich meals before PrEP, and stock your kitchen with bone broth, soft-cooked vegetables, and a fermented food for the first 48 hours after. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.